Welcome, everyone. Ready to dive deep today? We're going to untangle this whole world of anxiety and OCD.
Sounds intense.
It can be, right? But we've got a great guide, this Handbook of Clinical Psychopharmacology for Therapists. Don't worry, though. We'll break it down so it makes sense even if you haven't been to med school.
Absolutely. We'll make sure the science is clear for everyone. Maybe even give you some takeaways to use in your own life.
Exactly. And you know what's surprising? Anxiety disorders, they're actually even more common than depression.
Wow, really? I wouldn't have guessed that.
Yeah, it's true. So chances are, if you've ever felt that, that creeping anxiety, the tension, or maybe even full-on panic, you're really not alone at all.
That's a good point. It's easy to feel like you're the only one.
Right. So today we're going to learn what might be happening behind the scenes, like what's going on in our brains when all that happens.
Looking forward to it.
Okay, so first things first, when we say anxiety, what are we actually talking about? Is it just everyday stress or is there more to it?
It's definitely more than just, your average stress. The handbook makes this distinction between, general anxiety, that feeling of worry and tension that kind of lingers,
Yeah, I know that feeling.
and panic attacks, which are these sudden, really intense bursts of fear. It can feel like you're completely losing control, like you might even die.
Like a heart attack almost. I've heard people say that.
Yeah, exactly like that. The handbook even describes it as feeling like you will actually die or go crazy. It really captures how terrifying it is.
Intense. So panic attacks are like a surge then, and generalized anxiety is more of a constant thing.
Exactly. But the thing is, even though panic attacks are short, they can have this huge lasting impact. The handbook actually says people with panic disorder, they're 18 times more likely to attempt suicide.
That's a really sobering statistic. Really shows how serious this can be.
It really does. And anxiety, it can show up in so many ways. Physically, you might get trembling, shortness of breath, heart racing. Mentally, you might feel overwhelmed, on edge, or just have trouble focusing. It affects you completely.
Like your body and mind both going into overdrive, even if there's no actual danger.
Exactly. That primal fight or flight response, it's kicking in, even though there's no tiger chasing you.
So why does our internal alarm system go haywire like that? The handbook talks about like psychological and biological theories, right?
Right. And it's fascinating to look at how each tries to explain it. You have the classic Freudian ideas, about unresolved conflicts, anxieties coming from the id, ego, superego.
So Freud's saying anxiety comes from deep down, maybe stuff we're not even aware of.
Exactly. But that's just one piece of the puzzle. The handbook also gets into cognitive theories. These suggest that our own thoughts and interpretations, they can actually fuel anxiety.
So it's not just what's happening, but how we're seeing it.
Right. If we're always overestimating danger, underestimating how we can cope, that can create a vicious cycle.
Makes sense. It's like seeing a spider and thinking it's going to attack, even though it's just sitting there. You create the fear, not the spider.
Exactly. And those thoughts, they trigger physical reactions like that fight or flight response we mentioned.
So odds are huge. But the handbook also goes into the brain science, the actual biology of anxiety.
Oh, yeah. And what we've learned about it is amazing. Just imagine this complex network of nerves and brain structures all working to keep us safe. When we sense a threat, this system, the fight or flight response, it jumps into action.
So walk us through it. What's actually happening in our brain when we get anxious?
Well, there's this area called the limbic system, specifically the amygdala. It's like the brain's security guard, always looking for danger.
Okay, so what happens if it spots something?
When the amygdala senses a threat, it signals another key player, the locus coeruleus, or LC for short.
LC, got it. And what does that do?
Think of it like the adrenal gland of the brain. It releases this flood of norepinephrine, which is a powerful neurotransmitter, that puts your whole body on high alert.
Ah, so that explains that sudden rush of energy, that hyper-awareness.
You got it, like your body's prepping to fight or run, even if the threat is just, a presentation at work.
But what about when you're anxious for no reason? Why does the alarm go off when you're just chilling?
That's where it gets really interesting. Other neurotransmitters are involved, like GABA. It's like the brain's braking system. It calms everything down.
So GABA is the chill pill.
Exactly. It binds to receptors on nerve cells, opens channels that let in chloride ions. When those flow in, it makes the nerve cell less likely to fire, calming it down.
So if GABA is the brake, what if the brakes are bad?
Well, the handbook suggests some people might have a less effective GABA system, making them more prone to anxiety. It's like they're driving with faulty brakes, harder to control those anxious impulses.
Great analogy. Now it makes sense on a chemical level.
Right. And there's another player, serotonin. It actually inhibits activity in the LC, that adrenal gland we talked about.
So low serotonin means the LC is more likely to send out those anxiety alarms.
Precisely. It's all about balance. When these neurotransmitters work in harmony, we're calm, in control. But when that balance is disrupted, anxiety can take over.
So it's this whole symphony of brain chemicals and structures working to either ramp up or calm down anxiety. Fascinating.
It is, and it shows why understanding the neurobiology is so important. It's not just about thinking positive, it's real physical stuff happening.
Okay, so we've got the basics of anxiety and the science. But how does all this play out in the different types of anxiety disorders? Because it seems like anxiety can look so different in people.
You're so right. The handbook actually lists 10 different anxiety syndromes, each with its own unique characteristics.
10. Wow, that's a lot.
It is, shows how complex anxiety is. Ready to unpack some of these specific disorders?
Let's do it. All right, so we've got this whole map of anxiety disorders laid out. Where do we even start?
Well, let's kick things off with generalized anxiety disorder, GBE, probably the one most people have at least heard of.
Gay, okay. What makes it stand out from the rest?
Think of it like the always-on switch for anxiety. It's chronic, low-level worry. It can latch onto anything and everything, like a background hum of anxiety that just never quits.
So someone with GAD might be worrying about work deadlines, their kids, dinner, all at once.
You nailed it. And the thing is, for some folks, this might be wired into their brains, literally. The handbook talks about this biologically mediated vulnerability to stress as a possible factor.
So not just a personality thing, their brain could be more sensitive to stress.
Exactly, making them more prone to that worry and anxiety.
Helps to understand it, takes away that just get over it's kind of thinking, which doesn't help anyone struggling. So what's next on this anxiety map of ours?
Well, we've got anxiety tied to a specific event, stressful stuff. The handbook called it stress-induced anxiety, sometimes called an adjustment disorder.
Like when someone goes through divorce, loses a job, and their anxiety spikes.
That's it. Totally natural response to big stressors. Most times it'll fade as they adjust, but sometimes it can be too much, sticks around, then it might need professional help.
Our alarm system working right, but sometimes it gets stuck in the on position even after the danger's gone.
Good way to put it.
Okay, on to phobias. I think most people have at least one: spiders, heights, public speaking, the usual suspects.
Right, and the handbook points out these are mostly learned responses, often from a bad experience. Kid gets bitten by a dog, develops a fear of dogs, classic example.
Their brain links dogs with danger, triggers that fear even if most dogs are totally friendly.
Exactly. Faulty alarm system going off when there's no real threat.
How do you unlearn a phobia then?
Exposure therapy is key. Gradually expose the person to the thing they fear, in a safe environment, of course. The idea is to help them break that link between, the object and the fear response.
Retraining the brain to see it as less threatening, like, okay, this spider isn't out to get me.
You got it.
Now, what about social phobias? How's that different? Everyone gets nervous in social situations sometimes.
True, but social phobia, or social anxiety disorder, it's way more intense. We're talking debilitating fear, anxiety about being judged, humiliated, even rejected.
Not just being shy, it's fear that stops you from even going to the party at all.
Exactly. And the handbook, it suggests a possible link to separation anxieties, especially in childhood. Also, this theory that people with social phobia, they might have a lower threshold for activity in the locus coeruleus. Remember that adrenal gland we discussed?
So their alarm system's super sensitive when it comes to social cues, rejection, all that.
That's the idea. Their brain sees even neutral interactions as potential threats.
Wow, no wonder it can be so debilitating. Okay, on to another phobia, agoraphobia, often misunderstood, right?
Definitely. People think it's just fear of open spaces, but it's more than that.
Glad you brought this up. I used to think that too.
The real fear is about being trapped, like in situations where escape might be tough or help wouldn't be available if something went wrong.
So less about the space itself, more about feeling stuck.
Exactly. Could be crowds, public transport, even being far from home. And there's this specific type, agoraphobia without panic. So they haven't had full-blown panic attacks, but the fear is still there, limiting them.
Their anxiety's fueled by the thought of a panic attack, even if it hasn't happened.
Good way to put it. They avoid stuff because they're afraid of a panic attack, even if it never actually comes.
Sounds really tough to live with.
It can be. Their world gets smaller and smaller as they avoid more and more places.
So GAD, stress-induced anxiety, phobia, agoraphobia, what other anxieties are on our map?
We've got anxiety from medical conditions, substance abuse. Important thing here, the anxiety is secondary. It's because of something else.
So someone with a heart condition, their anxiety might be about their health. Or someone withdrawing from drugs, they might get intense anxiety as a symptom.
Exactly. Treating the underlying issue is key here. Manage the heart condition, address the substance abuse, and the anxiety often eases up.
Treat the root cause, makes sense.
Right, and then there's this thing called neurotic anxiety, a bit more complex.
Neurotic anxiety, don't think I've heard that one.
It's basically anxiety coming from unresolved inner conflicts, often unconscious stuff.
So not tied to a situation or trigger like a phobia.
Right, it's more about internal struggles the person might not even be fully aware of.
How do you even treat something like that?
The handbook, it suggests meds aren't usually the best route for this one. Instead, psychotherapy, specifically psychodynamic therapy, is recommended.
Why's that?
Well, because this type of therapy, it focuses on exploring, understanding those deep psychological patterns that are driving the anxiety.
So about gaining insight into those conflicts, finding healthier ways to cope.
You got it.
Okay, we've covered a lot, but still have two big ones, panic disorder and OCD.
You're right. Those are both complex, fascinating, deserve their own discussions, for sure.
Absolutely. Let's start with panic disorder then, shall we? We've talked about panic attacks, but it seems like panic disorder is more than just experiencing them, right?
You're right. It's not just the attacks themselves. Panic disorder of having recurring panic attacks, but also this intense fear of having another one. Anticipatory anxiety, they call it.
So it's not just the attack, but the constant fear of when the next one might hit.
Exactly. And this fear, it can be so powerful that people start avoiding situations, places where they think an attack might happen. It really limits their lives.
A vicious cycle, the fear almost as bad as the attacks themselves.
Absolutely. The handbook really highlights how important medication is in treating this. It talks about the neurogenergic hypothesis, which suggests that panic attacks, they're triggered by hypersensitive neurons in the locus coeruleus, or a problem with how norepinephrine functions.
So that adrenal gland of the brain, it's on high alert, sending out false alarms.
Precisely, and that's why meds that regulate norepinephrine can be so effective. They kind of recalibrate that overactive alarm system.
Makes a lot of sense. So treating panic disorder is about managing the attacks and the anticipatory anxiety, plus any phobias that might have popped up.
You got it, multifaceted approach. And the handbook also points out that panic disorder often goes hand in hand with other things like depression, alcohol abuse.
So a good treatment plan would look at all that as well.
Absolutely. It's about seeing the whole person and everything that might be going on.
This is incredibly insightful, really getting a clear picture of panic disorder and what might be happening in the brain.
Glad to hear it. We're making good progress on our anxiety map.
Now onto our final stop, obsessive-compulsive disorder, OCD. Another one that's often misunderstood, even made light of, I think.
You're so right. OCD is way more common than people think. The handbook actually says it's as common as panic disorder and 2 to 3 times more common than schizophrenia.
Wow, I had no idea. People often think it's just being quirky or organized, but it's clearly a lot more serious.
It is. OCD is chronic. It can have a huge impact on someone's life. It's these obsessions, intrusive, unwanted thoughts, images, urges, and then compulsions, the things they feel they have to do to relieve the anxiety those thoughts cause.
So not just liking things tidy, it's unwanted thoughts that cause so much anxiety. They feel they have to do certain things to make it go away.
Exactly. And the handbook stresses these obsessions and compulsions, they're not just quirks. They can be really time-consuming, disruptive, even debilitating.
Can you give us an example?
Sure. Imagine someone obsessed with germs. They might feel they have to wash their hands constantly, even when they're already clean. Or someone obsessed with symmetry, they might have to arrange objects perfectly, even if it takes hours.
Sounds exhausting and really distressing.
It is. And often, people with OCD know their obsessions and compulsions are irrational, but they can't stop.
Like their brain's stuck in a loop, no way out.
That's a good way to put it, and it gets even more complex. There are subtypes of OCD. The handbook mentions body dysmorphic disorder, where someone's fixated on perceived flaws in their appearance, and hoarding disorder, where it's really hard to discard possessions.
So OCD can show up in different ways, but the core is that intense anxiety and the need to do those compulsions to try and relieve it.
Exactly, and understanding this complexity is key for both diagnosing and treating it.
This has been such an eye-opener, exploring all these different types of anxiety disorders, from generalized anxiety to phobias, panic disorder, and now OCD.
We've just scratched the surface. This topic is so complex and fascinating.
I know. Amazing how much there is to learn about anxiety and how it impacts people. But before we wrap up this part of our deep dive, I'm curious, what can people actually do about these disorders? Are people just left to struggle with these fears and anxieties?
No, absolutely not. There are effective treatments for all of these disorders. There's hope for people with anxiety disorders.
That's really good to hear. So where do we even begin? Let's start with Katie. We talked about how it's this constant low-level worry. What does the handbook recommend for folks dealing with that?
Well, interestingly enough, the handbook suggests that for many people with KEDI, psychological approaches are the first line of treatment.
So therapy rather than medication.
Exactly. Things like stress management techniques, cognitive behavioral therapy, CBT, relaxation training, even meditation. These can be really effective in helping people manage their GAD.
So it's about changing those negative thought patterns, learning ways to cope.
Right, it's addressing those psychological roots. And for folks with GAD who are otherwise healthy, regular exercise can also be really helpful.
Makes sense. Getting those endorphins going can do wonders for mood and stress levels. But I'm guessing there are times when medication is necessary, especially for severe GAD.
Absolutely. When GAD is significantly impacting someone's daily life, the medication can be really important.
Okay, let's talk meds then. I know benzodiazepines are often prescribed for anxiety, but I've also heard concerns about, dependence and all that. What does the handbook say about that?
Yeah, there's been a lot of back and forth about benzodiazepines. It's true that long-term use can lead to physical dependence, but the handbook also says that most patients don't abuse them and they don't need like constantly increasing doses. It's about careful monitoring, responsible prescribing.
So they can be helpful when used appropriately, especially for short-term relief.
Exactly. And for folks worried about dependence or who have a history of substance abuse, the handbook mentions buspirone as a good alternative for GED. It specifically targets anxiety symptoms without those sedative effects of benzodiazepines.
Good to know. Having different options is important. What about antidepressants? I always thought those were just for depression.
You're right, they are mainly used for depression, but both tricyclic and serotonergic antidepressants, like SSRIs and SNRIs, they've been shown to be effective in treating GAD too.
So going back to the neurobiology, these meds help regulate serotonin, which can calm down that overactive anxiety response.
Exactly. And the handbook even mentions gabapentin, which is an anti-seizure medication, as a non-habit-forming option for GAD.
Wow, so there's actually a whole range of medication options for GAD, each of its own pros and cons.
That's right, and it highlights the need for personalized treatment. Working closely with a doctor to find what's best for each person is so important.
Okay, let's move on to anxiety associated with acute stress. This is where someone's anxiety spikes after a big life event, like losing a job or a serious illness.
That's it, it's that natural fight-or-flight response, but sometimes it hangs around even when the danger's passed.
So what's the best way to help someone going through that?
Psychological therapies are usually the way to go for these stress reactions.
Like CBT or talk therapy?
Exactly. But medication can be helpful in the short term, especially if the anxiety is really severe, keeping them from living their life.
So if they're really struggling, NEDs can help get through that initial tough period. Maybe help them sleep better too?
Yeah, it can give some much-needed relief while they work through the emotional stuff in therapy.
Now with phobias, the handbook seems pretty clear that exposure therapy is the gold standard.
Oh, absolutely. Gradually confronting the thing you're afraid of, it's the most effective way to get over it.
But what about specific phobias like performance anxiety, stage fright? Any advice for those?
There is. For occasional performance anxiety, the handbook mentions propranolol. It's a beta blocker, and it blocks those physical symptoms of anxiety, like a racing heart or trembling, but you can still think clearly.
So you still feel the nerves, but your body doesn't go into panic mode.
Exactly. It can be a lifesaver for those high-pressure situations where you need to be able to think straight and perform.
Interesting. So it's about managing the physical symptoms so they don't take over? What about more persistent social anxiety?
For that, medications like MAO inhibitors, SSRIs, or SNRIs can be helpful, along with therapy and social skills training.
Okay, so there are options for those specific phobias too. What about agoraphobia without panic? We talked about the fear of being trapped, even if there's no actual panic attack. How do you help someone overcome that?
Like we said before, behavioral therapy specifically graded exposure to the feared situations. That's the main treatment for this type.
Helping them face those situations little by little.
Exactly. But the handbook does say that medication can be useful, especially early on.
Why is that?
Sometimes medications like benzodiazepines or beta blockers, they're used to manage the anxiety as the person starts confronting those situations, like giving them extra support, lowering that fear response so they can do the therapy.
A delicate balance, giving support but not creating a crutch.
Exactly. The goal is to help them build confidence, learn the skills to manage it on their own.
Now for anxiety tied to medical conditions or substance abuse, the handbook is pretty clear. Treat the underlying issue.
Right. If the anxiety is a symptom of a heart condition or drug withdrawal, focus on that first. Addressing that root cause is essential for the anxiety to improve.
And we talked about neurotic anxiety, the anxiety from those deep internal conflicts, but it's treated with psychotherapy, specifically psychodynamic therapy.
Yes, exploring those unconscious conflicts and developing better ways to cope, that's key for this type.
Okay, so we've covered a lot of ground on how these different anxiety disorders are treated. Let's focus on panic disorder now, which we know can be so debilitating. What does the handbook recommend for that?
It emphasizes a combined approach, use medication and psychological therapy, so you're addressing both the physical and the emotional sides.
Two-pronged attack, I like it.
Exactly. And to manage those panic attacks themselves, medication is often crucial. The handbook mentions high-potency benzodiazepines. Those work well for calming down those intense fear responses quickly.
But we talked about the downsides of benzos, like dependence. Are there other options for people with panic disorder?
Yes, for sure. Antidepressants, tricyclics, SNRIs, SSRIs, they're all considered first-line treatments for panic disorder. They can be really effective at regulating those key neurotransmitters involved in the anxiety response.
And they might be better for the long term since they don't have the same dependence risk as benzos.
That's right. Finding the right med and dose for each person is key, which means working closely with their doctor.
Once those panic attacks are under control, what's the next step?
Then the focus shifts to managing that anticipatory anxiety, any phobias that might have developed because of the panic disorder.
Helping them feel in control, confident again.
Exactly. Cognitive behavioral therapy, CBT, is often used to help challenge those negative thought patterns, build coping skills for those anxiety-provoking situations.
So break that cycle of fear and avoidance that can keep people stuck.
Precisely. And because panic disorder often comes with other issues, like depression or alcohol abuse, addressing those is a crucial part of treatment too.
Got it. It's about looking at the whole person, everything that might be contributing to their struggles.
I couldn't agree more. It's not just about treating symptoms, it's about supporting the individual.
Now on to our final disorder, OCD. We learned it's more common than people realize, with those intrusive thoughts or obsessions and the compulsions to relieve the anxiety they cause. What does the handbook recommend for treating OCD?
The handbook acknowledges that it can be tough to treat, but effective treatments do exist.
That's good to hear. So what works best?
The gold standard for treating OCD is a type of CBT called exposure and response prevention, or ERP.
Okay, break that down for us. How does it work?
It's basically exposing the person to their feared objects or situations, but you prevent them from doing their usual compulsions.
So someone obsessed with germs who washes their hands constantly, ERP might involve having them touch a doorknob and then not letting them wash their hands right away.
You got it. The goal is to break that link between the obsession and the compulsion, to show them they can handle the anxiety without doing the ritual.
Sounds incredibly challenging, but also really empowering.
It is, and while therapy is the foundation of treatment, medication can also play a role.
What kinds of meds are usually used for OCD?
Serotonergic antidepressants, SSRIs especially, are the most common ones. They can help lower the intensity of the obsessions and compulsions, making it easier for someone to really engage in therapy.
So meds are a tool to support therapy, but not a cure on their own.
Right. It's about finding the right mix of treatments that work for the person's specific needs.
This has been such an insightful deep dive. Wow, we've covered so much: the science, the symptoms, the solutions.
It's been great exploring all this with you.
Before we wrap up, any final thoughts or takeaways for our listeners?
Absolutely. The most important thing to remember is that while anxiety disorders can be incredibly tough, they are treatable. Effective treatments exist, and with the right support, recovery is possible.
That's a powerful message of hope that I think we all need to hear. For anyone out there struggling with anxiety or OCD, please know you're not alone.
And knowledge is power. The more we understand about these conditions, the better equipped we are to get help, support others, and fight for better mental health care.
Thank you for joining us on this deep dive. We hope you found it helpful and insightful. Until next time. All right, welcome back to our deep dive into anxiety and OCD. We've spent the last two parts mapping out the territory, the different types of anxiety disorders, the brain science, all that. Now let's talk solutions. What can people actually do if they're struggling with these conditions?
Such a crucial question, and it's really important to emphasize there are effective treatments out there. There's hope for people with anxiety disorders.
That's reassuring to hear. So where do we start? Let's stick with generalized anxiety disorder, GAD, that constant low-level worry that can just take over. What's the handbook recommend for dealing with that?
Interestingly enough, for a lot of people with GAD, the handbook suggests psychological approaches first.
So therapy, not megs right away.
Exactly. Things like stress management, cognitive behavioral therapy, CBT, relaxation techniques, even meditation. These can be really helpful for managing GAD.
So it's about changing how you think, learning to cope better.
Right, addressing the psychological roots. And if you've got good but are otherwise healthy, regular exercise can also make a big difference.
Makes sense, endorphins, all that. But I'm guessing there are times when medication is necessary, especially if the GAD is severe.
Absolutely. When it's really impacting your day-to-day life, meds can be a big help.
Okay, let's talk about those then. Benzodiazepines, they're often prescribed for anxiety, but there's those concerns about dependence. What's the handbook's take on that?
Yeah, benzos, there's always a lot of talk about them. It's true, long-term use, it can lead to physical dependence, but the handbook also says most patients don't misuse them, and they don't need their dose constantly increased. It's all about careful monitoring, responsible prescribing.
So they could be useful if used right, especially short-term.
Exactly. And for people worried about that dependence or who've had problems with substance sports, the handbook mentions buspirone for GAD. It targets anxiety specifically without the sedative effects you get with benzos.
Good to have options. What about antidepressants? I always thought those were just for depression.
You're right, they're mainly for that. But tricyclics and serotonergic antidepressants like SSRIs and SNRIs, they've been shown to help with GED too.
So back to the neurobiology. These meds help regulate serotonin, which can calm down that overactive anxiety response.
Exactly. And the handbook even mentions gabapentin. It's an anti-seizure med, but it can be a non-habit forming option for GED.
So there's a whole toolbox of meds for GED, each with pros and cons.
Shows how important it is to personalize treatment. You and your doctor got to work together to find what's best.
Okay, let's move on to anxiety from acute stress. This is that spike in anxiety after something big happens, right? Like a job loss, a serious illness.
That's it. The fight or flight response kicks in, but sometimes it just doesn't go away, even after the initial stressor is gone.
So how do you help someone navigate that?
Usually, psychological therapies are the best approach for these kinds of stress reactions.
Like CBT, talk therapy, all that.
Exactly. But meds can help short term, especially if it's really severe, stopping them from functioning.
So meds can help them get through that initial rough patch, maybe even sleep better.
Yeah, give them some relief while they work through the emotional stuff in therapy.
Now with phobias, the handbook seems pretty set on exposure therapy being the gold standard.
No doubt about it. Facing your fear gradually, that's the most effective way to get over a phobia.
But what about specific phobias like performance anxiety, stage fright? Any specific advice there?
Actually, there is. For the occasional bout of stage fright, the handbook mentions propranolol, a beta blocker. It blocks those physical symptoms like a racing heart, the shakes, but doesn't cloud your thinking.
So you still feel nervous, but your body doesn't go haywire.
Exactly. Really helpful for high-pressure situations where you need to be sharp.
So you manage the physical stuff so it doesn't take over. What about more persistent social anxiety?
For that, MAO inhibitors, SSRIs, SNRIs, those can be helpful along with therapy and learning social skills.
So there are options for those specific phobias as well. Now, what about agoraphobia without panic? That fear of being trapped, even if there hasn't been a panic attack. How do you help someone with that?
Like we said, behavioral therapy, specifically that graded exposure to those feared situations, that's the main treatment.
Helping them face those situations bit by bit.
Exactly. But the handbook does say meds can be helpful, especially at the beginning.
How so?
Sometimes benzos or beta blockers, they can help manage the anxiety as the person starts confronting those situations. It's like a little extra support, taking the edge off that fear response so they can engage in the therapy better.
Like a safety net, but not something they become reliant on.
Exactly. The goal is to help them gain confidence, learn to manage it themselves.
Now, for anxiety that's tied to medical conditions or substance abuse, the handbook is pretty clear. Treat the root cause.
Absolutely. If the anxiety is because of a heart condition or drug withdrawal, you focus on that first. Dealing with the root of the problem is essential.
And we talked about neurotic anxiety, the kind that comes from those deep internal conflicts, best treated with psychotherapy, psychodynamic therapy in particular.
That's right. Exploring those unconscious conflicts, finding healthier ways to cope, that's a key.
Okay, so we've covered a lot of treatment approaches for different anxiety disorders. Let's move on to panic disorder now. We know it can be really debilitating. What does the handbook recommend?
It really emphasizes a combined approach, medication and therapy, so you're tackling both the physical and the emotional aspects.
Attacking it from both sides.
Exactly. And to manage the panic attacks themselves, medication is often really important. The handbook talks about high-potency benzos. They're effective at quickly calming those intense fear responses.
But we talked about the downsides of benzos, the dependence risk. What other options are there for people with panic disorder?
Plenty. Antidepressants like tricyclics, SNRIs, XSRIs, those are all considered first-line treatments for panic disorder. They can be really good at regulating those neurotransmitters involved in anxiety.
And they might be a better choice long-term since they don't carry the same dependence risk as benzos.
Right. It's about finding the right medication and dosage for each person, working closely with their doctor.
So once the panic attacks are under control, what's next?
Then it becomes about managing that anticipatory anxiety and any phobias that might have developed because of the panic disorder.
Helping them feel in control again, confident.
Exactly. CBT is often used to help people challenge those negative thoughts, learn how to cope in anxiety-provoking situations.
Breaking that cycle of fear and avoidance.
Precisely. And remember, panic disorder often comes with other issues like depression or alcohol abuse. Addressing those is a crucial part of the whole treatment plan.
It's about seeing the whole picture, every piece of the puzzle.
Couldn't agree more. It's not just about symptoms, it's about supporting the whole person.
Now on to our final stop, OCD. We learned it's way more common than people think, with those intrusive thoughts, the obsessions, and the compulsions people feel they have to do to relieve the anxiety. What's the handbook's approach to treating OCD?
It acknowledges that OCD can be tough to treat, but it also says effective treatments do exist.
That's encouraging. What are some of those effective treatments?
The gold standard for OCD is a type of CBT called exposure and response prevention, or ERP for short.
Okay, what's that all about? How does ERP work?
It's basically gradually exposing someone to the things they fear, but preventing them from doing their usual compulsions.
So if someone's obsessed with germs and always washing their hands, ERP would be having them touch something dirty and then stopping them from washing right away.
You got it. The goal is to break that link between the obsession and the compulsion, show them they can handle the anxiety without the ritual.
Sounds really hard, but powerful if it works.
It is. And while therapy is the main treatment, meds can also help.
What kinds of meds are we talking about for OCD?
Serotonergic antidepressants, especially SSRIs, these are the most common. They can help reduce how intense the obsessions and compulsions are, so the person can do the therapy more easily.
So meds is a support, not a cure on their own.
Right. Finding the right combination of treatments for the person is what matters.
Wow, what a deep dive this has been. We've explored the science, the symptoms, the solutions, so much.
It's been a pleasure unpacking all of this with you. Really complex topic, but so important to understand.
Before we wrap up this whole episode, any final thoughts you want to leave our listeners with?
Absolutely. If there's one thing to take away, it's this. Anxiety disorders, they can be incredibly tough, but they are treatable. There are effective treatments out there, and with the right support, people can recover. There's hope.
That's a powerful message, one we all need to hear. And to anyone listening who's struggling with anxiety or OCD, you're not alone in this.
Remember, knowledge is power. The more we understand about these conditions, the better we can get help, support others, and push for better mental health care for everyone.
Couldn't have fit it better myself. Thanks for joining us for this deep dive, everyone. Hope you found it insightful and helpful. Until next time.